why in iron deficiency anemia we get increased RDW, red cell distribution width, which basically means variation in the size of RBCs. The image I posted just now, you have noted that the RBCs are of variable sizes. So what actually makes the size of the RBC so variable in iron deficiency anemia, which is indicated by a parameter in the complete blood count, that is RDW. RDW stands for red cell, R for red cell, D for distribution, and W for width. And it's an important parameter in the complete blood count that increases in patients with iron deficiency anemia. Now, progressively in this session, in this short session, we try to understand why RDW increases in iron deficiency anemia, or in other words, why we get marked variation in size of red blood cells in case of iron deficiency anemia. So to understand this, first you need to understand that when you are looking at a peripheral blood smear or in the peripheral blood, the RBCs which you are getting, normally RBC has a lifespan of 120 days. But when you are looking at a peripheral blood smear, which is reflective of our peripheral blood picture, all the RBCs are not exactly released from the bone marrow into the peripheral blood 120 days earlier. Some of them they might be released 110 days earlier, some of them they might be released 115 days earlier, some of them 90 days, some of them 60 days earlier. Now the size of the RBCs, how much smaller the RBCs are, that exactly depends on at that point of time what was the extent of iron storage status in the bone marrow. Because in these conditions, what we get iron deficiency anemia is an example of microcytic hypochromic anemia. And that also need to be understood here to understand the concept of RDW. Now, why we get microcytic hypochromic anemia in the iron deficiency anemia? The reason is very simple. You can, as I mentioned many times, you always need to think RBC like a bag full of hemoglobin. And the body's sole purpose, this cell's sole purpose is to carry hemoglobin only. That's why the nucleus has also been kicked out from the mature RBC. Because this cell has a monomaniacal obsession to carry hemoglobin only. Now what happens that in iron deficiency anemia, as you don't have iron, you cannot make heme. As you cannot make heme, you cannot make hemoglobin. So obviously when you cannot make hemoglobin, you cannot put enough hemoglobin inside the bag, inside the RBC. And obviously as a result, the RBC size shrinks. It becomes smaller, microcyte cell. And it also becomes less red colored because hemoglobin is the pigment which gives it the red color. So it becomes microcytic hypochromic. Now connecting this concept, as you now understand that not all the RBCs which you are seeing on a peripheral blood smear, they are exactly released 120 days before. There are some of them they are released 60 days before, where maybe some of them they released 90 days before, where maybe the iron stored status was much better. So the relative size of RBC was little bit bigger. It was less than 80 femtoliter, because less than 80 femtoliter is characteristic microcytic, but maybe it was 65 femtoliter. But as progressively with time the bone marrow iron status depleted, what happened? The RBC which was released from the bone marrow, let's say 40 days before, its size becomes not 65 but let's say 55 femtoliter. The RBC which was released 10 days before, as the bone marrow iron status depleted more, the RBC size became let's say 25 femtoliter. And as it is, so the point I'm trying to emphasize here is that the size of the RBCs are variable in the iron deficiency anemia because the status of iron deficiency in the bone marrow is also not constant. It is also changing with time. If you treat it, then relatively it would become more, the iron status. So the RBC size would become relatively bigger. So when you are looking at a peripheral blood smear, the RBCs are basically showing a mixed population which are released at various point of time from the bone marrow to the peripheral blood. And as a result, we are seeing the RBCs of variable size on the peripheral blood of the patient of iron deficiency anemia. And that is causing increased red cell distribution width, because red cell distribution width or RDW is nothing but it's a marker of degree of anisocytosis or variation in the size of RBC. So when there is a much more pronounced variation, more severe variation, more marked variation in the size of RBCs, RDW, red cell distribution width, also increases. And that's why we really care about this parameter in the complete blood count of a patient with iron deficiency anemia. And that's why when you are looking at that peripheral blood smear, which I just now posted, of a patient with menorrhagia in a 42-year-old female who has actually, obviously due to the chronic blood loss, it could be due to many things like fibroid or uterine lymphomas multiple, which will result to menorrhagia. So the point is that due to the chronic blood loss, she has developed iron deficiency anemia. And as a result of iron deficiency anemia, on the peripheral blood smear, we are seeing the characteristic feature of iron deficiency anemia. One of the features is marked anisocytosis of the RBCs, which is indicated on complete blood count by increased red cell distribution width. Now, RDW is an important parameter, red cell distribution width, because it helps iron deficiency anemia to differentiate from other types of anemias also. Like, for example, in beta thalassemia minor or trait, it is not raised, you understand. So that's how it can be helpful to differentiate IDA from beta thalassemia minor. So in a summary, red cell distribution width is a marker of degree of anisocytosis, degree of variation of size of RBCs on the peripheral blood smear. It's an important parameter in the complete blood count, and its value is raised or elevated in iron deficiency anemia. Because iron deficiency anemia, the various RBC size variation is basically because that RBCs are released from the bone marrow at various point of time, and that it is basically their size is indicating the status of iron storage at that point of time in the bone marrow. And that's why we get raised RDW in the iron deficiency anemia. In another video, I'll be explaining about the question, which has been another question commonly asked, that why TIBC, total iron binding capacity, is increased in the iron deficiency anemia. I'll be discussing in a separate video. Thank you so much.